Good morning, students. We will start with another chapter under sources of data for pharmacoepidemiological studies. I have not prepared these slides, but I'll give you the notes, right? So the next chapter is ad hoc studies. It is also called as field studies. Ad hoc, ADHOC, ad hoc studies. They are also called as field studies. Any awareness about field studies? Have you heard? Let us understand by interacting with you. If anybody has got any awareness. Anne Maria,
Yes, sir.
what do you think the field studies are?
I don't know the correct answer, but I think the studies conducted during the post-marketing surveillance.
Okay, you are near to the answer. Let us try with another person. Sonam. Sorry,
Yes, sir.
Yeah. What do you think?
Sir, I just joined because of network issue. Can you repeat the question?
What do you think about a field study? What they are?
Field study, where you go and interact with other persons to collect the data.
You said that we need to interact with the person, another person. Where you need to interact?
Suppose if it's in a community, like if it's a study based on community trust or something like that, we go and interact with the what I don't know.
Okay. No, my question is that where do you go and interact?
Suppose if it's disease related, we go to hospitals and all.
Go to hospital. Okay. Only one part of the answer is missing from your statement. Okay, let us go to Aparna.
So we can conduct some interviews or something and collect the data.
Where do you conduct the interview?
So if it is related to a disease, we can interact with the patients and collect the data.
Where do you interact?
Maybe
What is
in
the
the
place of
hospital.
interaction? Within the hospital. Okay, we will move on to Aquina.
Sir, I don't know.
Okay, Ashwin. Soni. Any idea, Ashwin, Soni? Atira James.
Is it they'll go to different places like outside the laboratory, sir?
Yes. You mean they will go to fields?
Yes, sir. Like outside any field area like community or hospitals or
Yeah, that's correct. So these studies are done in fields. That is where it's called as field studies. So these are the studies that are done in fields to collect the data to evaluate hypothesis. That is the study question, correct? So these are the studies that are done in fields to collect the data to evaluate hypothesis. They're called as field studies. Anybody has any doubt? You're all clear about it? Yes? Can we move on to the next part of it?
Yes, sir.
Yeah. The types of ad hoc studies are cohort studies, case control studies, case control surveillance, cross-sectional studies, post-marketing randomized trials, that is the phase 4. So these studies come under the class of ad hoc studies as they are done in fields. We have already understood what are these studies from our earlier methodologies, correct? So let us move on to strength of these studies. What are the strengths of the study and weaknesses? Because we know that each study will have its own strength as well as weakness. So what do you think that strength of this study, when we know that the studies are done in fields to collect the data, what would be the advantage you can think of? Benjir?
Sir, we'll conduct in outside like community basis, so like more information we'll get in
Mm-hmm.
uh, that only, sir.
Yeah, correct. We will get the information. We will get the information so that you can which you could not able to get in other database such as administrative database. So when the administrative database is taken, the data would be inadequate. But when you go to field study and start interacting with them and collecting the data, you will get the data more than what is required, what was documented in administrative database. That is perfect. And also this data is obtained by asking the question number one, and also from the outcome of the field study. See, when you start the study, patients start recovering, correct? The moment they start recovering, they will open up with so much of information that information will be more than what you usually get it in the hospital, because we know that administrative database are recorded in the health maintenance organizations, correct? So when they come there for study purpose, they may not disclose all the information. But when you go to study in their fields and when they recover, you will get the data more than what is there in the administrative database. That's one thing. What would be the another advantage, Irene? Irene, Sarah,
Yes, sir.
what would be the other advantage you can think of?
Sir, we can get more accurate data,
Accurate data. No,
the more
actually,
practical, like
huh,
we face more a practical world other than data.
correct. Yeah, that
Yeah,
is why we have understood that we get a data more than what is there in the administrative database, correct? So
yeah.
naturally, the data will be accurate only because you are directly interacting with them and trying to get the answer out of them. What would be the other advantage you can think of, strength?
Sir, the firm which collects the data, they only will be having access to the data.
Which forms you mean?
Like us only, like we'll only be get an access to that.
No, which data it is, which form it is. Which form you're talking about? Okay, let us
Like
move on. Yeah, you would like to say something, Irene?
no, sir.
Okay, we will move on to Kessia, Korean. Yeah.
Sir, to understand whether the drug was effective for them.
Whether the drug was effective. So it helps to validate the treatment that was given to them. It helps to validate. You will confirm, yes, that is what it is. Correct? Yeah, that's right.
Yes, sir.
Next, Kezia Rachel. Any other advantage you can think of?
So,
Any other advantage you can think? Does it validate a diagnosis also?
No, sir, I don't know.
Okay. Lakshmi Jayachandran.
Yes, sir.
Does it validate diagnosis?
Yes.
Yes?
Yes, sir.
Yeah. So you can confirm the diagnosis which is done in the hospital will also be the same in the field, right? So that means the patient has not lied. So it helps to validate diagnosis.
Yes.
Correct?
Yes.
Yeah. Manoj, is there any other advantage or strength you can think of?
Don't know, sir.
Mega?
Sir, like due to different exposure, we can get different outcomes and we can compare that.
Yeah. That's what it like, when you conduct the study, you will get the data. All the data which you're going to get as from the outcome will indicate something about the life of the patient. Can you guess what would be that? When you take the treatment and the life of the patient improves, and there is an indicator for that. What is that?
Sir, I didn't get you. Can you repeat?
When you treat the patient, the life of the patient improves, and you
Yes.
can confirm with one parameter known as,
Uh, so the data is collected.
yeah, life of the patient improves. So there's one indicator, like a measuring parameter.
Mm, no, sir.
No. Quality of life. Can you confirm the quality of life?
Yes, sir.
Yeah. So when the patient receives the treatment and improve from the treatment, and when he start performing the many activities of his life, then one can confirm that the quality of life is improved, right? So this is the
Yes.
advantage of field study. Correct? You could able to understand that what I'm trying to ask you?
Yes, sir.
Yeah. Marlin, is there any other advantage?
Sir, I'm not getting other than this.
Okay. Navindran?
No idea, sir.
Nikita?
Don't know, sir.
Ria Pillai?
Sir, it also helps in understanding various complications.
Various complications.
Complications.
You will understand various complications which are frequently seen
Yes, sir.
or rarely seen.
Complications which are rarely seen.
These field studies helps to know whether the conditions are rare or very rare conditions can be obtained, which is not reported to the hospital or administrative services. So subjects with very rare conditions can be enrolled when you visit the hospital. Ria Sara,
Yes, sir.
any other data we can get it from when we actually go to fields?
So the social economic status, based on
Yes,
that, you can get the data.
social habits and social economic data, correct. Social habits also will get whether they are really drinking, smoking, how much they are doing, what they would have said in the hospital will be different from what actually they will be doing it. So you will get the social habits data. And you can also get socio-economic data, how much they are earning, what is their cost of living. So such kind of things can be obtained, correct. Sai Srileka, is there any other
Uh,
information which we can get it?
so we can get to know like which category of people are getting more affected if any new adverse
Affected.
events.
Huh.
Yeah.
Yeah, not category exactly, but you'll come to know how many people are getting affected, correct?
Yes, sir.
That's what you wanted to say?
Yes, sir.
Okay. Sufficient? Sufficient Shadi? Sherin Babu?
Yes, sir.
Yeah. Is there any other advantage?
Sir, adverse effects can be studied and the
Adverse.
safety data can be included.
That is also there. Adverse reactions can also be documented. Yes. Then Tenzin, any other advantage you can think of?
Don't know, sir.
Okay. Amal Jishnu? Anju Varki? Aparna?
Don't know, sir.
Aquina? Any idea? Aquina? Aswin? Sony?
Sir, these are relatively inexpensive.
Mm-hmm. Which one is inexpensive, you think?
These automated data systems.
Oh, we are in different chapter, my dear. Field study. We are in field study. Forget about that automated database.
Then don't know, sir.
Okay. Atira?
Don't know, sir.
Can you get OTC medications the patients were taking?
I didn't get you, sir.
Can you get the information about OTC medications?
Yes, while interviewing, we can get the informations which all drugs they're taking other than the prescribed ones.
Okay. So these are the advantages of, are the advantages, or you can say a strength of field studies. So very rare conditions can be documented. You get more information from the outcome as well as through interview. You can validate diagnosis and treatment. You can get the data on social habits, OTC medication, quality of life, including adverse drug reactions, right? Which is very rarely seen. Let us understand the weakness. Let us understand the weakness of the study. What would be the weakness you think? One second. What would be the disadvantage you can think of?
Sir, time consuming and all.
Yes, time consuming. Very correct. Time consuming is the problem. So you have to keep on searching, keep on interacting to get the data. So it is time consuming. So since it is time consuming, what would happen on the expense?
It would be more expensive, sir.
Yes, more expensive. Very good. Since we know that this data, for collecting the data, you may have to travel. Yeah, you may have to. Oh. ಇರೇ ನೋಡಿ ತಿಕ್ತಾ ಇದೆ. So you may have to visit the places. So one person cannot keep on visiting all the places, and you cannot go all the time, every month for 2 years, 3 years. So in such cases, the study have to be done, and the number of places to be covered. So in such cases, what will happen to the staff requirement?
More number of staffs are required.
Yes, more number of staffs are required here. Yeah. And we know that taking the example of India itself, we speak different languages in different states, correct? So what would be the problem a person from one place trying to visit another place? A person who knows English trying to visit different states, what would be the major problem you can think of?
The language barriers.
Yes, language barriers. Language barrier is the main problem. Yes, not only within the country, but also outside the country during the international studies, right? Next, you may have to visit the places, right? And also you have to interact with the people, and patients also will respond. The patient will respond uh, actually as soon as the patient as soon as the researcher will come. So sometimes patient will be hurry, or sometimes staff will be hurry. So what can go wrong with the data? Can you guess? Anybody can guess? A researcher has come in front of the home trying to do field studies, and patient is in hurry, and this researcher has caught him for data. So the information which is given, do you think that it is going to be accurate? No. So if the information is not accurate, so what kind of problem will come across professionally in the data?
Analysis will be done.
Yes. Analysis variation will come. So that variation in the data, because of this kind of information, wrong information is known as what technically? We have studied this.
Bias.
Bias, yeah, that's right.
Errors.
That's right. Not errors, it is a bias. You're always worried actually. You're always worried, okay, whether the data is authentic or not. This we call it as information bias. This we call it as information. So the information bias may be from staff, because staff become restless by the time they do up to evening. So they may cook up the data and they may report it. So information bias is taking place. Or during the collection of the data itself, they would not have given the proper answer. So information bias again happens. Patient may not be cooperative, but they will show all the signs that you can finish off the assessment. So information bias is always expected from staff, patients, as well as during the collection of the data, right? So this is about the disadvantages of field studies, right? In the next class, we are going to understand how do we design the field studies, how do we collect it, how do we design, and how do we go about it to conduct these field studies. Now you have already read so many research articles and you have written the summary also. I guess you might have got some fair idea how the things will be done in a systematic manner. So just for our understanding, let us understand in an overall manner the steps. So in the next class, we are going to understand it specifically. Let us start with Amal Jishnu. Amal Jishnu, what would be the steps which we can think of? Amal Jishnu, how can we design the study? What things are required? Anju working? Aparna,
Yes, sir.
what do you think steps will be?
First, we have to select a topic.
Yes, select the topic or the research question. Very good. Next, what would be the next step?
Next, we have to prepare the questionnaire or
Mm-hmm.
that's it.
You have to prepare the questionnaire. Okay, you mean data collection form?
Yeah.
Okay, data collection form. Okay, that's good. Then we will move on to Aquina. Aquina, what would be the other steps?
Sample size.
Sorry.
Sample size.
Sample size. Oh, you have to calculate the sample size. Very good. Next, what would be the other things you want to set up?
Methods.
Sorry.
Methods.
Methods. Okay, method. Okay, fine. So you want to set up the method or a procedure, correct?
Yes, sir.
Yeah, procedure is set up. Okay. Next, we will move on to Atira James. Did we complete Atira James?
No, sir.
Yeah, Atira, tell me what other steps you want to take. One is design the question. Other one is preparing the question data collection form. Next one, setting up the procedure. Then
So we have to calculate the cost.
cost also you want to calculate. Okay.
Then how will the category of the patients which will be included?
Okay.
So I don't know, sir.
No, correct. We are trying to understand generally, right?
Yes, sir.
Generally. Any other things you want to set up?
The plan, like which all places to go,
Which are
and
places to go? Yeah.
this much only, sir.
Okay. Benzene.
Sir, after setup, what results we'll get, we'll see, and then discussion about that, and then calculation, conclusion.
Conclusion. Okay. Good. Next, we will move on to Irene Sarah. Any other things you want
Yes,
to?
sir.
Any other things you want to set up?
No, sir. Like after collecting the data, we have to evaluate the data collected and presenting the data and all, and we can check in other other secondary sources also.
Okay.
That's it.
Oh, that's it. This ends up the setting of the data, setting of the ad hoc studies, correct?
Yes, sir.
Okay. Kessia Korean.
For analyzing the data using different methods.
Okay. Statistician. We will give you the statistician. Okay. Then.
That's all, sir. I don't know.
No other steps are involved. These are enough.
Don't know, sir.
Okay. Do you require computer
Yes, sir.
database? You mean that? I mean database. You require it?
Yes.
Why you require computer database?
Have to store the data.
Collected. Correct.
Yes.
Okay. Next, we will move on to and we did. I guess we did. Kessia Rachel. Kessia Rachel. Anything else you wanted? Kessia Rachel. Lakshmi.
Yes, sir.
Anything else you want, Lakshmi, to set up?
It's identification of the problem.
Identification of the problem. Oh, okay. Then how do you solve the problem?
Based on data collected.
Okay. But when you think that you can identify the problem?
Conducting interviews or.
Okay. So any solution is there for you? Any solution you have thought of? How do you solve this problem? Oh, you're very good at identifying problem. Very nice. Okay, good. Your point is right. So I was expecting a different, one more step forward. That's good. Good answer.
Okay.
Manoj.
Yes, sir.
Anything else you require, Manoj? Is this enough?
So, yes.
Don't know. Okay. Megha.
Sir, we need to know, we should have more knowledge about the topic we have selected so that, we should know that is there any other research has been done similar to this topic so that we can compare between the similarities and the differences between those two studies.
Now, my question is that to set up this ad hoc studies or field studies, so we have identified the parameters. Somebody says that research question should be ready. Somebody says that procedure should be ready. Somebody says that identification of problem. Somebody says that you need to collect, design the data collection form. Somebody says that assess the cost. Somebody says that you need a computer. Correct. So like
Yes,
this,
sir.
is there anything else is required to set up this field study? That's what my question.
A study population.
Study population, yeah, sample size. Somebody already told that. Is there anything else you need?
Uh, so, no idea, sir.
No idea.
Almost everything is covered, no,
Oh,
sir.
everything is covered. Okay, very nice. Marlene, Sarah.
Sir, particular staffs required.
Ah, yes, staffs are required. Very nice. Very nice. Yeah, staffs are required. Yeah.
They
Okay.
should be assigned to whichever places they.
Oh, you want to assign the responsibility also. Very good. So what about whether all should speak one language or different language they can speak? Not a problem at
Different languages, sir.
all. So all staff should speak different languages.
No, sir.
Ah,
They should know various languages.
they should know various languages, but they should be able to speak one language. That's what you mean?
Sir,
No, no.
they
What I
should
mean,
be
uh,
able
what
to
time? Yeah.
with.
What is it? Please, please convey again.
They should. They should be able to communicate with uh, a different population.
Okay, but they should all know one language, common language. You are expecting.
A common language and other languages.
So you are expecting
So
both. They should have both, right?
yeah.
Yeah, correct. You are right, absolutely. So we will take up this chapter in detail from next class onwards. If you have any questions, you can ask me. Otherwise, in few seconds, we are going to delink. You don't have to link back, right? You can ask any questions or clarity. Otherwise, it is. Thank you.